Hit your cancer. See Dr. Lederman. 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. That's right. This is Dr. Gil Lederman. We're talking about cases, talking about things that may help you. Next is a woman from Switzerland, about 80-year-old woman with anal cancer. So anal cancer and rectal cancer, even though the anus is close to the rectum, are totally different. Totally different cancers, totally different treatment, totally different history, totally different spread. So she had an anal cancer that had spread to the inguinal nodes. She's being treated in a stereotactic frame with us, daily treatments. She was seen by her other doctors. This is the end of her treatment. She finished it this week, and she was told that she's in remission. So she'll be back to see me for a full physical exam in a couple of weeks. But she is fully functional, doing great, happy, hopefully saved her bottom, saved the anus, which means she has her sphincter, which means there's no colostomy. She had just non-invasive treatment and has done superbly with her anal cancer T3N2 stage. We will see her back and report back to you on her on a regular basis. Another patient who has a gynecologic cancer. I've seen this woman for 4 years. She came into what used to be Cabrini Hospital. She saw me in the lobby. Cabrini had closed by the state because they wanted to save healthcare dollars, although it didn't make sense because Cabrini was a low-cost hospital. If they wanted to save dollars, they should close an expensive hospital that charges $2,000 or $3,000 a night and leave Cabrini open, which was charging about $800 a night. But who can figure out? Seems like the big boys have all the marbles and the little boys get squeezed. Anyway, she met me in the lobby 4 years ago with metastatic cancer, gynecologic cancer. She wanted radiosurgery. She heard about radiosurgery. She searched for me, found me, and she's had radiosurgery intermittently for the last 4 years. If she has a cancer that pops up, we treat it. And if not, she lives a healthy, normal life. She goes back to South America, which is her home, every year for several months, usually for a few months. She just finished a course of treatment of radiosurgery for gynecologic cancer. She has what's called a mixed Mullerian cancer. It's a cancer of the gynecologic organs. It has spread, so she's stage 4. But she doesn't want chemo. She doesn't want to be attached to an IV. She doesn't want all the complications of surgery. So when the cancer acts up, we treat her. And when it doesn't act up, we just follow her. She gets staging, scanning, but she does not wish or get chemotherapy. And this is now going on 5 years with an excellent quality of life. And I think we have a phone call here. So let's say hello. Good morning. How are you?
Good morning.
How are you today?
I'm doing well, thank you.
Okay.
Dr. Lederman, I'm 58 years old, and I just had a yearly blood work done. And I guess my PSA last time I had it done was 2.5, and it went up to a 3. And the doctor recommended that I go to a urologist, and I did. And he said, well, my prostate was a little bit enlarged. It was nothing that I should be worrying about. And I said, well, at my age, I am a little worried about it. And then I asked, can you do a test to see if my prostate is okay? And he said the only way he could do it is through a biopsy. And I was wondering, is that the only way I can have it checked? And is a 3, PSA of 3 for a 58-year-old okay?
Well, I just talked at the top of the hour about this man that came to me last year with a 2, almost identical to you. He's been running 2s, and then this year he came in with a 3.5, and I encouraged him to have a biopsy because the PSA had jumped almost by 50, 60%, and he had a Gleason 7 cancer. So the proportion of the jump is important as well. I don't do anything without a separate test because PSA can fluctuate. So first thing I'd probably do in someone like you is to repeat the PSA. There's other things you can do to look at the prostate, and getting an MRI is another thing you can do to evaluate the prostate. Again, and the conversation really takes an hour or two, and that's the best way to answer all your questions. But in general, there is a possibility of having cancer. You can get ideas from the MRI scan, and that may help guide you. And then you may have to be prepared if you have cancer. Do you want to be treated? So there's a whole series of steps.
Right.
When you start getting PSAs, why are you getting the PSAs? Are you getting the PSAs just out of curiosity? Are you getting PSAs that if it goes up, you're going to do something about it? So sometimes doctors and the patients don't have this discussion, but they really need to have this discussion every step of the way. Why are you getting the PSA? I mean, if you're not going to do anything about it, then you shouldn't get a PSA, right?
Right. Well,
and then if the PSA goes up, you should be prepared to answer the question, well, what are you going to do about it now?
Right. Does a PSA go up naturally when you get older with your prostate becoming enlarged?
It can a little bit, but that can be confused with the cancer. And the PSA can go up as laboratory error. PSA can go up with infection of the prostate. PSA can go up with sexual activity. So it's not specific, and that's why I would get another PSA now. I would sit down and talk to you about this whole issue. And so you're informed as to all the possibilities. I wouldn't just do it with one PSA.
All right. So I'll call on Monday and I'll make an appointment.
All right, and if you call us, we'll also send you our booklet about our work. Thank you for calling, and good luck. I hope you have nothing and you live to be 120.
Thank you very much, sir.
All right,
Have
God bless you.
Bye-bye.
And speaking of prostate cancer, actually, our next patient was a man pretty young man, about 60, similar age, with metastatic stage 4 cancer. So this man is from Europe. He's moved to the United States, and he came to us with a mass in his skull of prostate cancer. So he had a painful mass in his head. We treated with radiosurgery. He came for scanning yesterday, and he's in complete remission. So our work does work. And for those of you with cancer, this is about the end of the show, so you're welcome to call us at 212-CHOICES. We're a cancer treatment center. We take most insurances, Medicare and Medicaid. We're located at 1384 Broadway. We have booklets available at no charge for brain tumors, brain cancers, cancers of the body, and the third one is about prostate cancer and options and the actual data, the data from our center with thousands of men treated and from other major centers across the country, from Proton Beam, all the other options. You'll see us versus the other and where you get the best results. You can imagine where you get the best results. Thank you for listening. Our next show is on WOR this morning at 1:30 for an hour, and also at 3 in the morning, and then at 6 a.m. Thank you, and God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist, first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York. A Cumulus station. 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 A Cumulus station.